work. Oh, so many societies have participated, and they have led the program, and I think good awareness has been built up. Hmm?
Yes.
Okay
We'll
then.
start,
Okay.
ma'am.
Yes,
Ma'am, shall we
please start.
start, ma'am?
Yes, yes, yes.
Yes, please
Yeah.
start.
Rajeshri, ma'am, shall we start?
Rajeshri Bandra?
Badiyare.
Yeah, let's start. Let's start
Okay.
the
Okay.
program.
Yeah.
Okay, sure. Yes, ma'am.
Arun.
Hello, good evening, Rajeshri.
Or-
Good evening. Good evening.
Yes,
Hi.
Over to Arun for the prayer. Good evening.
ma'am, beginning.
Start. Shall I start, Rajlakshmi? Okay.
Yes, ma'am. Yes, ma'am. Start.
Okay. Good evening, everyone. Today, 9th August, is being observed as Abhaya Day nationwide by FOGSI and Kasoga and all societies all over India to commemorate Calcutta Archikar victim doctor and to strongly oppose the increasing incidents of violence against doctors. All of we know are aware of the 2024 August 9th incident. It's a great tragedy. To honor her memory and to reiterate our collective commitment to Abhaya. Abhaya means state of fearlessness. Abhaya is safety, dignity, justice for women and healthcare workers. All of us have the right to live without fear at their workplace and in the street also and in the hospital environment also. Marking that dark day, our FOGSI and Kasoga, through its Public Awareness Committee and to Prevent Violence Against Women Committee and IMA and all other health sectors have united to observe this day as Abhaya Day. This day serves as a call for everyone to awaken, unite, so that life-saving protectors can work without fear to achieve a state of Abhaya. From our Kasoga Abhaya Day observed throughout state, it was started with a press release by our own proud president of Kasoga, Dr. Rajeshri Palladi at Mysore. And we had many rallies, very many silence and pledges, jatas, press statements, and articles, and all India radio programs. So from almost all societies of Kasoga so far, more than 32 programs have been reported to myself and Dr. Rajalakshmi. We are compiling the report. By tomorrow, we are sending it to FOGSI, and our FOGSI WOW committee secretary Dr. Rajalakshmi is already compiled. And if doctors and healthcare workers themselves remain unsafe, how can they safeguard patients' interest? So the hands that heal the patient and protect the suffering must not tremble in fear. They must receive a shield of Abhaya, that is assurance, and violence on them. It should not be in silence. Let us break the silence and speak out. On August 9th, let us all stand together for a fearless tomorrow. Let there be safety without fear of everyone. Today, to mark the occasion from Kasoga, we are conducting this webinar for which our own Secretary and President Dr. Rajeshri Palladi and FOGSI National Coordinator Dr. Kiranmai for Prevent WOW Committee is there with us to enlighten us more. So to start the function, I just start with the invocation over to Arun, and I call upon our Secretary General Dr. Shobha Gudi to welcome the gathering after this introduction. Thank you. Thank you. Over to Dr. Shobha Gudi, madam, for the welcome address.
Very, very good evening to all of you. And on behalf of Kasoga and on behalf of FOGSI also, let me welcome each one of you to this very, very momentous occasion where we pledge ourselves to the cause of prevention of violence. 1 minute, just a minute. Yeah, I hope I am better audible now. Better
Yes.
audible with less disturbance. Yeah. So, prevention of violence against women, prevention of violence against doctors also sometimes we need. This is a very great initiative, I must say, and an awakening of conscious effort to voice out against violence. And I'm really grateful first and foremost to the past president of FOGSI, Dr. Shanta Kumari, for bringing forward this motto of Dhira, and which has actually been the seed which has been sown in FOGSI, from where this enormous plant has grown, a tree it has become now, wherein which has inspired Foxians to have courageous thoughts and to go forward and have preventive strategies, preventive thoughts, preventive um, statements, and so many advocacy programs to conduct against violence against women. So, with that, I hand over to our president, Dr. Rajashri. As we spoke in the beginning, Kasoga has not been behind in this effort, and I am very grateful to the committee which has been taken up this as a crusade, and I am very grateful that Foxy gave us the opportunity. Over to you, Rajashri, because I believe that you have also contributed in a huge way in this initiative. Thank you, Veena, and thank you, Rajlakshmi. Thank you.
Thank you, madam. Over to our president, Dr. Rajashri Palladi, madam.
Good evening, everybody. And it's a matter of great concern that all of us on a Sunday evening have assembled on the Zoom platform here to address an issue which has raised horror across the country and been such a matter of uncertainty for what the medical profession holds in the that we all rise up to this call and take it up as a matter that we of having the safety for all the women in particular, if not the medical professionals or the medical caregivers, that as I'm standing here traveling in this train, I read a display here which says that harassing women passengers is a punishable offense and under section 354, 509 and 394 of Indian Penal Code and 146 and 162 is punishable act. So although such displays and such awareness is being created everywhere in all the public places and all the places of work, but still a woman in India is not safe to move freely on the streets and work freely in the hospitals and especially the care providers. So it's a great effort which has been taken up by the FOGSI, by a visionary leader, Dr. Bhaskar Pal, from where this originated. And we were so helpless. We were just protesting and we were just being witness to all the victim who was ravaged and nothing could be done because of many factors which were prevailing. But now is the time that we no longer sit back and take this offense being created, and a great appreciation for Dr. Kiran Mai, who has taken a lot of efforts to call personally and involve us in this participation in a big manner. And this call went to everybody across the country. And also Kasoga has not been behind to take up this initiative. I must very much appreciate the Mysore OBG Society under the leadership of Dr. Sonia and Dr. Sindhuja. They knew that I was there on the 8th of this month for the very prestigious Kaulwood CME, and we wanted to make it as a remark in the media as well, because what happens is that under the fear of the media, first of all, that we succumb, the doctors succumb, and the media themselves should be made aware. And we had a very good interaction and answered many of their queries regarding to why maybe it is because of the discrepancy of the charges. Then our answer was, then why does such offense occur even in the government medical colleges or government hospitals? So this is the psychology of the people, the population, the public, that they treat doctors as a soft victim. And for whatever is the concern and whatever even the political or even the family background they have, they kind of express it in the public when it comes to an institution or to a doctor. So many such scenarios are there, and it's time that we reinforce and make everybody understand that the hands that heal needn't be held and should be held back in providing our care and treatment. And we should be effortlessly doing our job with the conviction that we believe in what we are doing, and there should be no compromise in the quality care that we defer, because it's time that somehow it's come to a time that doctors are forced to save the skin first rather than save the patient. So this is slowly becoming a silent epidemic, that the defensive practice is coming into force. So that is a very, very bad signal to the community, that if this breaks, the bond of trust and bond of association between the doctor and the patient breaks, then it's the society which will be suffering at large. And what about the future generation and the message that we are giving it to the generation ahead, that is it all right to become a doctor? First of all, you train yourself to 10 to 15 years to become a good professional. And then you spend a considerable amount of time and energy and efforts to make a good practice. And then you have to go defensive. Then where are we going? So this is the kind of situations that we are all facing. And this is not exclusive to India, because many countries across the world have been facing such. And there's a report which says that 2 to 3 out of every 5 doctors face the situation at one point in time or another, from the residency through the practice. It's not necessary that a doctor with 30, 40 years of experience will be shattered in a moment when this goes viral on the media, that one doctor or one patient had a suffering and there was a death due to some unavoidable causes. And it has been a kind of very, very sad situation, that media can take the misutilization of the power. And this is what Sonia, me, and Sindhuja, along with Dr. Amnish Pandiwad and the president of the Mysore OBG, Mysore Hospital Association, we represented that this is not that it is exclusive for the OBGYNs, it's all the doctors who are facing these scenarios, and this is what we wanted to convey. And thanks to Dr. Kiranmai, that all across Pan India, she's been actively involved in this. And I must put a word of great appreciation to Dr. Veena and to Dr. Rajalakshmi, who have been marching like soldiers ahead to create this program and awareness. And relentlessly, they have been doing this work, especially when it comes to public awareness and violence against women. I feel so proud to see their work, and it calls a lot of dedication to do this kind of work. And I must also thank Mr. Arun, being a Sunday, but this Arun says we don't know how the days are passing in Kasoga. You're putting us on right, but yes, this is how it is. And when we want to reach out, there's so much to do and so much to create. And this is the power of togetherness. This is the power of society involvement. This is the power of believing in the common mottos that we all stand for. And yes, it's not that one day that we need to. And this was very smartly answered when somebody asked, what are you doing tomorrow as a relay or a public event? This is not a relay or a public event which we want to create a morcha on the street for one day. This has to go into the mindset of everybody and into the heart of the public, that doctors are here for healing and not for hurting. Thank you so much for giving me this platform. And I thank Bhaskar Pal sir, and I thank Kiran Mai, and I thank my team of Kasoga soldiers, Dr. Veena, Dr. Rajalakshmi, and the Mysore OBG Society, Dr. Shobha Gudi, and all the members, all the societies who have been. See, this becomes something personal. This is beyond any kind of description that we have in the protocol. Every one of us can be affected by this at any point in time. So this is for us that we are standing up, and thanks everyone for this wonderful opportunity and platform.
Thank you, Rajashri Madam, for your valuable and inspiring words. And now there is it is time to go to Dr. Kiran Mai Madam, who is a real national coordinator and such an inspiration behind all these programs. And over to Dr. Rajalakshmi to introduce Dr. Kiran Mai.
Yeah. Thank you, Veena ma'am. Good evening, everyone. It's my proud pleasure to introduce Dr. Kiran Mai ma'am. She is the national coordinator for the Abhaya Day today, and she has got all of us from north to south, east to west, everybody together to have conduct so many programs today. She has been the chairperson of FOGSI No to Violence Against Women Committee during 2022 and 25. She has been the core member and faculty of DERA initiative. She is presently professor and HOD of OBG at Government Medical College, Vanapati, Kaloji University of Health Science at Telangana. She has uh, she has been on many positions in the FOGSI and local societies. She has been national corresponding editor of Jogi, scientific convener of AICOG, and she has been the trainer for many of the gender-based violence, trainer of trainees for global maternal perinatal death surveillance, response workshops, TOT on Dakshata, and she's also received lots of accolades for that. Dr. Kamini Rao, Viva FOGSI Orator, FOGSI Dira Award, MS Signature Award, and Best Doctor Award. It's our pleasure to have you over here today, ma'am. It's been always a pleasure working with you. You have inspired and motivated us to work for this cause. Over to you, ma'am. Dr. Kiranmay, ma'am. She will be speaking on wow, how it is going to affect focus on women healthcare worker safety at the workplace. Over to you, ma'am. Dr. Kiranmay, ma'am.
Thank you. Thank you so much, Kasoga. Yeah. Are you able to hear me?
Yes, ma'am. But we can't see you, ma'am, now. Your video was...
There is some internet.
We can hear you, ma'am.
Oh.
Yes, ma'am.
Yes, yes.
Okay. Yeah. I think there is some lag in the internet. So thank you to Kasoga. I think stupendous work, amazing work. Since I think I've been the chairperson of FOGSI No to Violence Against Women Committee, I have relied on Karnataka and the soldiers of Kasoga, Dr. Rajalakshmi, and then Dr. Veena Bhatt, and so many others who have joined in the campaign of No to War. So in a way, I'm very, very close to Kasoga. I feel whenever there is a campaign or whenever there is an initiative, I immediately call up. Rajalakshmi is one of the first persons that I call up, and I trust, and I know for sure that Karnataka will come up with maximum number of programs, and I don't even worry. Like I don't have to worry. So Rajalakshmi has been one of the very core members of the No to War committee. She was a pillar of support and such wonderful programs of quality, variety, and also number. The jatas, so many programs she has done. So when this Abhaya initiative responsibility was given to me, so again I knew 2 years back also we did Abhaya when the incident happened. I know I think it was not one day feeling for us. We were all shocked, and we cannot describe the hurt it caused to us. It went on and on and on and on, and 3 months were disturbed. Hear me? I don't know, some disturbance. Are you able to hear me, Rajalakshmi?
Yes, ma'am. We are able to hear, but it's breaking. I think you can switch off the video, ma'am. Then we'll be able to hear better. Or you're sharing your slides.
Internet. I have changed the internet, but
okay. Now we can see you, ma'am.
Yes. Okay. Some lag is there. Okay.
Yes.
So it was maybe 3 months and more that we went on protesting the whole state. And we took it up in a big way, and 100 societies had taken part in the Abhaya protest on September 9th. So it was 30 days and no justice. So FOGSI had given a call of where is the justice for Abhaya. So again, nearly 100 societies had taken up that call, and a lot of protests and lot of rallies happened. And again, it is 2 years the government has changed, and yesterday, today morning and yesterday at Hyderabad, at the Global Congress, Dr. Bhaskar Pal sir had shared his thoughts on Abhaya especially. So how after the government has changed, they are waiting for justice, and it's still active in the case. Oh my God, you got your baat pakki? And what we should do. I mean, how we have to wait, and how we have to follow up the case, and how we cannot forget and leave. And Dr. Basab Mukherjee, he also was, very emotional. Actually, yesterday evening, the Dheera program, and today morning, Abhaya made everybody very emotional and committed, I should say. And Dr. Basab was telling that to archive and take up what happened every day after the incident, and how it had been. Because after 3 years, 4 years, everybody forgets and nobody remembers what happened. So he was saying that we should not let this be forgotten, and we should keep it alive, and we should keep doing this Abhaya, or symbolically of dedicating this to no to violence against doctors and everything. So I also thought after 2 years, again the National FOGSI Abhaya Day, because Bhaskar sir is very much emotionally attached to the cause and to the girl being from Kolkata. So he wanted to do this again. But again, everybody felt, and I also felt, that it is not a once in a year or once in, one type of or one event in a year, or maybe after a few years and we forget. So maybe we can make this Abhaya campaign into a real active campaign for violence against healthcare workers, and also incorporate safety specifically for women healthcare workers. So we cannot forget this. We cannot leave this issue. We cannot just protest for one day or 1 week or 1 year and then forget. So we have to keep this cause of Abhaya alive. And as Rashri was very, very she made very, very, impactful statements just now. It is about us. It is not about anybody else. So we have to take this forward. If you really have to think of our future generations of doctors, to give them a safe platform, to safe space, it is our obligation and responsibility to not to forget and to keep actively working on this cause also. So with this, I would like to share a few slides and thoughts on this violence against healthcare workers with specific relevance to women healthcare workers. Hope I am audible.
Yes, ma'am, you are audible.
Yeah, thank you.
It's raining everywhere, ma'am. That's why I think some network issues are there.
Yeah, yes. I have changed the internet also, but somehow it is dipping in between.
Now it's visible and audible, ma'am.
Okay. I think you all remember Dr. Archana in Rajasthan. I think when Shanta Madam was president, this gruesome incident happened. For a maternal mortality of PPH, who was a multiparous, high-risk pregnancy, and she was working in a periphery, providing service for many years. She was known for many years providing quality service in a very remote area. Even then, when maternal mortality happened, the whole, the people have ganged up, and they have blackmailed, and they have harassed her so much emotionally, and with mob mentality and everything. So much was going on. She felt so helpless. And can you imagine? I mean, she had to commit this act of suicide. You can imagine the amount of emotional disturbance or depression, and the feeling of isolation and loneliness which she must have faced. And being a qualified gynecologist, rendering service and saving so many lives, she lost her life for an unavoidable cause, and for which she was not primarily responsible. She was trying to save a life. So again, so much of protests and everything happened, and finally, I think we all have forgotten. And then this murder in Kerala hospital, this also was so. Even when you hear it now, it's very disturbing. I mean, if you imagine your own child or your own young doctors who is sitting in a OPD or who is sitting in a PHC, and she's there doing her duty, and they face this kind of heinous crime of stabbing multiple times by a patient without any provocation. Later, they say that that patient was mentally disturbed or the patient was a prisoner and there was no enough security and there was no handcuffs and so many issues. But the parents have lost and the country has lost such a young and capable doctor, and who will pay for this or who will replace this loss. So the violence against healthcare workers has come to such an extent that loss of life also is being normalized. Maybe 10 years back when you hear this, it was unimaginable. But now, doctors committing suicide, doctors being, hit and having uh, grievous injuries, and even homicide, murders. And then came the final act of Arjikar Kolkata hospital incident, which shook us like anything. So it has come to that extent, and still, I think there is nothing else. I'm not able to move my slides. Yeah. So this is the Arjikar incident. So much of media glare happened, so much of protests have happened. I think lakhs of students, lakhs of people continuously, agitated on the roads, bringing life to standstill. So many politicians have joined. The Supreme Court was involved, and that is why we are still not able to forget Abhaya, and we're still trying to find justice for her. So the World Health Organization defines workplace violence in the health sector as incidents where staff is abused, threatened, or assaulted in circumstances related to their work, including commuting to and from work, involving an explicit or implicit challenge to their safety, well-being, or health. So this is widely prevalent. Again, like violence against women, it is underreported, understudied, and instead of violence against doctors, the better term may be violence against healthcare workers, because not only doctors, the paramedical staff, the nursing staff, everybody face this challenge, especially those working in the front lines, the young doctors, everybody. So this is an urgent problem requiring attention from all the societal stakeholders. Of course, it is not just a medical fraternity issue. See, when we say violence against women, we keep thinking, and everybody keeps thinking that it is a women's issue, which is not at all true. So violence against healthcare workers is again not a medical fraternity issue. It weakens the health system and affects the quality of services provided to patients. As Dr. Ashri was telling, already we are in the we are getting habituated to a defensive practice, and we are always watching over our shoulders, and we are always watching our documentation, we are always watching our video cameras, we are always alerting security whenever there is any mishap, whenever there is any untoward event which is happened. So it was not there maybe 2 decades back. The trust, there is erosion of trust, there is always this fear of something going wrong, and a sense of risk to life. And also now after Arjikar, the threat to not just life but sexual violence, the brutal beyond imagination kind of incident which has happened. So the key to breaking away from this vicious cycle is pushing for immediate zero tolerance policies. I mean, it should not be normalized. It should not be like dowry deaths happening and everybody is accepting, acid attacks happening, everybody is accepting, and female infanticides or sex selective abortions happening, and everybody is kind of normalizing because they happen in such a number. So this violence against healthcare workers also, it's happening so frequently that everybody, even we are sometimes so tired of reacting or even counting the incidents. and they are happening so frequently. So the main issue is the zero tolerance, and it should be dealt with most serious punishments immediately, and society or government or doctors, nobody should have any tolerance, any kind of abuse. So workplace assaults and violent acts occur in the health sector more than any other industry, and many studies all over the world have reported the prevalence of workplace violence among physicians to be as high as 56% to 75%. Can you imagine? It is like 75% of incidents happen, and patients and their relatives are the most common perpetrators of non-fatal workplace violence. And a study in 2014 in Manipur found 78% of doctors had experienced some form of violence. Again, WHO statistics also tell the same. It's a very grim picture. Not only that, the IMA study has found that the doctor's lifespan and health span is less than 10 decades when you compare it to other non-medical people. So we lose 10 years of our life because of the pressures and the stress in workplace. And on top of that, whatever professional life we are leading is filled with these assaults and abuses and constant threat to health and mind and body. So the spectrum is, one is violence by attendants, violence at the workplace by colleagues. Of course, the POSH Act and other things come into this spectrum. Then sexual abuse at workplace, sexual assault, rape, and brutal murder. I think Abhaya is one very, very, very grim example of this. And then fatal attacks, for example, Dr. Vandana in Kerala, who lost her life. And then emotional and mental abuse, which can lead to suicides, like Dr. Archana in Rajasthan. So this is one of the incidents which has happened at our hospital in Usmania Medical College. Actually, this was uploaded in YouTube by somebody. Young intern was there here, and there was a death of a prisoner because of abortion related complication. And it was, of course, a sudden incident, a sudden death. But what has happened later was, it shook us like anything. The young intern was beaten with IV stands, and she was injured on the head, and she finally left her profession. And she was hardly 22, 23 years old. And the whole hospital was ransacked, and we all had to run for our life. I think this is one of the first physical assaults that I had faced in my life. And it went on for 1 month. There was strike, and at that time, this has resulted in one of the laws and imprisonment. This act, the Andhra Pradesh Medicare Services Persons Services Institutions Prevention of Violence and Damage to Property Act 2008. Dr. Rashekar Reddy was the CM then, and we went on strike for almost 1 month, and then this act was passed. So actually, this was a very good act, and we returned to work after this. But after that, there was improvement of security, police outposts, the presence of police, and all those things have improved definitely. But after that, what happens is dilution of all these things. Slowly, they will withdraw the police, or they don't respond, and still the acts continue. But this was one of the first acts which had come in response to doctors' agitation to this physical assault. This happened in Andhra Pradesh. So again, another act which I remember was a gynec postgraduate was there, and what happened was, the case which had come to our hospital was not related to obstetrics or gynec, so she had referred her to Usmania Medical Government Hospital. So immediately it was very hot in the emergency room, and immediately she got abused and physically assaulted. Her chain was snatched, glasses were broken, she slapped her cheeks, and she was a young postgraduate. And this happened again in 2013 or 2014, and this again prompted us. I'm telling, so many times we protest and we stop work, but nothing improves. So this was a very huge rally of all the associations in Hyderabad, which we had taken. and the work was stopped. PGs went on strike, but nothing much happened. So, ending violence against healthcare workers in India, a bill for a billion. So, this was in Lancet, and a recent survey I was talking about by IMA reports that 80% of doctors in India are stressed out in their profession, and 56% of doctors do not get a comfortable 7 hour sleep most days of the week, and 13.7% fear criminal prosecution most days of the week, and 82.7% of the doctors in India feel stressed out, and 46.3% fear violence is the main cause of stress, and 24% fear being sued, and 62.8% doctors surveyed are unable to see their patients without any fear of violence, and around 57.7% have thought of hiring security in their premises. This is a study by Indian Medical Association, and the prevalence, again, there is no data analysis or data collection in our country, but roughly in the newspapers and the media, 153 reported incidents of violent assaults against healthcare workers. This is highly, highly underreported. And again, this why being underreported, the Lancet says that this is high for a country which is not in a conflict zone. Maybe a country which is in a conflict zone like war or some other crisis, it may be accepted. But in a country is not in a conflict zone, even this 153 incidents of underreported incidents is not acceptable. The violence against healthcare workers instance rate in India was 57 and 850 times greater than that in UK and China. Again, China, we say it is very high now, but India comes in the top 5 or 3 countries where the prevalence of violence against healthcare workers is very high. So we contribute to 1% of healthcare workers. From 2016 to date, we contribute to 3.4% of global incidents. See, our healthcare workers are 1%, but the incidents are 3.4%. So a rate of 3 violence against healthcare workers incidents per 10,000 healthcare workers, which is 5 times greater than the global rate. This is again the Lancet paper. This had second highest rate after Afghanistan, which is considered a conflict zone. You can see it is a global pattern. Some might be saying that this violence against doctors or healthcare workers, this happens all over the globe. But again, when you see the difference, our country definitely has very, very high rates, which has to be addressed. And then came COVID. After all these incidents, already we were suffering. And in COVID, very paradoxically, many doctors had given their lives, had given their time, have sacrificed their families. So many doctors, without vaccine we worked, and we were the first population which had taken vaccine before the general population. It was nothing short of a war. We were like soldiers in front of the pandemic, and we had saved so many lives. We had stood in between the pandemic and the people, but still during COVID, the violence has escalated, just like domestic violence, which gets escalated when the woman is vulnerable, like in pregnancy, etc. Same thing happened to doctors. If you all remember, we were shunned by our friends, and we were not given. We were not allowed to enter the premises, or people used to run away seeing us. They would not rent homes to doctors. So many things happened. We were kind of alienated from the society despite all the service. Doctors have been abused, beaten up, denied entry and residence, and obstruction to cremation. This also happened. Is the last straw that this is the again there was a protest and there was a black day from IMA during the COVID times, and also IMA and the entire medical fraternity had been asking for central law by ordinance. So COVID warriors were also not spared. So in the COVID, again, in single year of 2020, 225 incidents happened and 110 events in 2021. And instead of being a protected time or a glorified time for doctors and healthcare workers, this violence has increased during COVID time. Both physical assault, denial of services, obstruction, eviction from home, cyber attacks, heavy weapon attacks, individual weapons, psychological threat, everything has increased globally in violence against healthcare workers during COVID time. Then came the Epidemic Diseases Amendment Act 2020, so which was a central act recognizing violence against healthcare service personnel as a cognizable and non-bailable offence. Under this act, the perpetrators of violence were supposed to be imprisoned for 3 months to 5 years and fined 50,000 to 2 lakhs. But it is inadequate and it was considered a temporary solution to a systemic issue, as it would be dissolved once the pandemic is declared. This is only for the epidemic diseases or for the pandemic. It was not a general law. So when we examine the evolution of legislation addressing violence against healthcare workers in India, in Maharashtra alone, between 15, I think you recently you must have seen the incident in Maharashtra where a political counselor had come and attacked physically a woman doctor, a young girl, and a young intern resident. Both of them suffered injuries, and both of them had left their jobs, and they have one has resigned and one has left the city. And there was huge hue and cry, but I don't know whether with this huge cry and protest would prevent such attacks, and we've been hearing again and again. So in Maharashtra, in 5 years, there were 636 complaints and 1318 arrests related to violence, but only 4 convictions were secured. So the problem was not just in the law's provisions, but in the loopholes that allowed criminal lawyers to circumvent conviction, rendering the laws toothless. That is the real problem. So now, after the PV Act of 2008, which I mentioned, which has first come in AP, and I think our hospital incident was the reason for this PV Act 2008. There are state laws in 25 Indian states now and union territories, which are called the Medicare Services Persons and Medicare Service Institutions, which is the Prevention of Violence and Damage or Loss to Property Act 2008 that punishes perpetrators of violence against healthcare workers. In most states with this act, VA-HCW is a cognizable and non-bailable offence. 4 states and 5 union territories still lack any kind of law against violence against healthcare workers. So then came this Healthcare Service Personnel and Clinical Establishment, that is Prohibition of Violence and Damage to Property Bill 2019 by Ministry of Health and Family Welfare. This is supposed to be a central bill with a clear definition of violence against healthcare personnel, health workplace and health workforce, with imprisonment up to 7 years and up to 5 lakhs, and grievous injury 3 to 10 years, and penalty of 2 lakhs to 10 lakhs for grievous injury, plus to pay for damages in cases of vandalism, and reparation of 1 lakh INR for hurt and 5 lakh INR for grievous hurt. Everything was there in this. And the bill was framed and finalized through democratic engagement, seeking public suggestions. So had a greater societal acceptability. But it was rejected by the Ministry of Home Affairs, stating that passing the bill would set an improper precedent for other fraternities to demand exclusive protections based on their profession. So we cannot give to healthcare workers this exclusive protection. That is what the objection by the Ministry of Home Affairs was. So Survey of Healthcare Personnel of India regarding functioning of Violence Prevention Acts by All India Federation of Government Doctors Association. So this was a survey. So how much of awareness is there in our own healthcare workers about these laws and violence prevention acts? So there was a Google form which was circulated throughout the country, and 76% are aware of the act, but only 7% are confident of its functioning. So we don't have trust in that, though we know that there are some acts, some laws, but only 7% are really confident that it will protect them. So what is the awareness and implementation of the PV Act? An RTI petition by the Medical Legal Action Group, Chandigarh in Punjab and Haryana, about the perpetrators punished under the Medicare Act found that not a single person was booked from 2010 to 2015, which was in stark contrast to the number of violent incidents in the states. So the number of incidents are in hundreds, maybe thousands, but no one was booked. And the existing state laws are weak in their implementation. Though the laws are there, but they're weak in their implementation, they vary a lot and lack scope to protect all HCW cadres. And in 2018 and 19, 10 states had multiple strikes in response to bureaucratic and judicial inaction to incidents of violence against healthcare. We see every 1 or 2 months, one or other state goes for a strike, does some lot of, dharnas and all. So in 1 year, 10 states had multiple strikes. What more we should do? I mean, we think that we should do. We've been doing. See, apart from working, apart from taking care of our patients and families, if you have to do all these strikes and dharnas and everything, and still state or nobody responds, what else can we do? So in 2019, in the state of Maharashtra, out of 157 violent incidents, only 77 were reported, 71 were charge sheeted, only 2 were decided, and none of them were convicted. And activists filed a criminal public interest litigation in the High Court of Bombay to improve the state's Medicare Act. So again, after the PIL, the High Court clearly defining the workplaces and services, exhaustively enlisting healthcare personnel to be protected under the law, including different forms of damages, including mental harassment and economic damages, introducing graded penalties fitting the severity of crimes and punishments, making vandals pay compensation, setting up a distress helpline. This is all suggested by the High Court, creating a platform for FCWs to lodge complaints and conducting security audits of the hospitals. So these are all the things which were suggested. And challenges in enacting the central law. A central law has not been enacted because public health is a state subject. And BAHCW is primarily a public health related issue. So the concurrent list allows for a central law. The central government has not prioritized this issue, leaving it for the states to manage. That is another kind of issue here. So again, coming to Telangana, lot of cases have happened, and what happens after violence here is they are investigated by a DSP level officer or at least first class magistrate, and these cases here in Telangana are investigated by, in other states it happens by investigation is done by DSP level officer or at least first class magistrate, whereas in Telangana a station head investigates, leading to delays, and penalty for offenders in case of violence is higher in Telangana when compared to other states. This is the difference between state to state. And law does not cover someone attacked outside hospital, despite the issue being belonging to the hospital. Nurses, ambulance drivers, and diagnostic staff also not protected under the current law. So what are the legal reforms in Kerala? Again, the state after state goes on fighting in the courts, on the roads. A PIL in the Kerala High Court versus UI, which requested the state government to improve protection to doctors. And because this is after May 10, 2023, gruesome incident of Dr. Vandana, junior doctor, who was killed on duty in Kerala. She was fatally stabbed 11 times in chest by a drunk school teacher using scissors on the dressing trolley. The resulting, only after a life is lost, that too so brutally, then comes an act. That is the really tragedy of the story. The resulting Kerala Healthcare Service Persons and Healthcare Service Institutions Amendment Act of 2023 came after Dr. Vandana lost her life. This is now considered one of the strongest state laws in India for protecting health professionals, and it extends to a wide range of healthcare workers like doctors, nurses, paramedics, pharmacists, lab technicians, clerks, ministerial staff, and security guards. And the High Court has directed an FIR be filed within 1 hour after the instance of violence. They called it the golden hour, much like the golden hour that we use to treat emergency situations like heart attacks, strokes. So the High Court said this should be the golden hour for doctors also. So now Kerala Act, again it's a cognizable and non-bailable offence, and expedited delivery of justice by stipulating that inspector must complete an investigation within 60 days of filing an FIR. Once produced in court, the victims must be examined on consecutive days. This ensures that the court trial process is short and not drawn, maybe 60 days. The Kerala Act has also given provisions for special sessions courts with a special prosecutor to try cases under this act to ensure something like a fast track courts for violence against healthcare workers. Coming to Karnataka, following recommendations by the Karnataka Law Commission in 2018, Karnataka passed the Karnataka Medical Registration and Certain Other Law Amendment of 2024. This is also recent, which amended the 2009 Act and made it even more potent than the Kerala Act in protecting healthcare workers. It encompasses all provisions of the Kerala Act and introduces additional measures to close significant loopholes that had previously hindered convictions. So now the Karnataka Act shifted the burden of proof onto the accused, not on the victim. I mean, the victim should not prove that whatever allegations were thrown on him are wrong, but it is burden of proof is on to the accuser. The other loopholes, coming to the loopholes, the other loophole that prevents conviction, of course, is that when criminal lawyers of the accused argue that there is no intention to hurt the health professional from the end of the accused, but that it happened spontaneously due to an emotionally triggering event because of the loss of the patient and worsening of the pity or the sympathies lie with the people who lost lives, but they don't think that it is, how is it the fault of the doctor? So the Karnataka Act does not, however, provide safeguards for this particular loophole. So coming to the emergency codes, we all have codes for our patients. We have code blues, we have code reds and all. But what is the code for our own sake? So code blue is medical emergency like code cardiac arrest. Red is for fire or smoke emergency. Brown is hazardous spill. Yellow is patient or visitor is missing. Code pink is infant. We all see, especially in the corporate hospitals, all these codes and what has to be done. But where is the code for violence against healthcare workers? When the healthcare worker is assaulted physically or otherwise in the hospital, preventing them from work and ransacking the premises. So this code is now called code violet. And many people still don't know what this code is, but this is there in the National Health Mission website called Quality Assurance Cell, Code Violet, and there are SOPs for management of violence in healthcare facilities, SOPs for Code Violet. But again, how many are aware how much the government is taking care to percolate this to down till the PHCs or any other hospitals? How many of really are they serious about this, except on paper? So this is one of the pictures. I think this is from the Vijayawada. The incident happened in Kolkata, but such scenes we saw everywhere in every city. I think Rajlakshmi also shared from her own place and Manipal and everywhere. So there were thousands of people, citizens who came out onto the roads and who had done huge protests. This is civic society also was this time very much involved. This was picture was from Vijayawada, and this was from Hyderabad. And these are the pictures I'm sharing from 2024 after the Abhaya incident. I think this is shared by Dr. Rajlakshmi, if I remember correctly, this candle march. This is from our own health secretary, the junior doctors, and everybody had gone to Telangana State Commission for Women and given representations. And then the Junior Doctors Association, they have asked for these. When we see the letter given by the Junior Doctors Association, see what they have asked for. I mean, is it something from the moon that they are asking? Designated restrooms, police presence, CCTV coverage, safety mobile app, security checks, accountability, anti-harassment committees, access control, working in pairs, unannounced field visits, gun licenses. Gun licenses was out of desperation that they have put it, because if you are not able to protect us, at least give us licenses for guns. See the other things that they are asking, or doctors were asking for. Again, this is from AP state. They have given to the health minister. So this was when we were following very closely the Arjikar incident. This was observation by the Chief Justice of India. He observed that doctors lack place of resting. No basic hygiene is maintained for them. Lack of security in medical health. These are his observations. In medical healthcare units, doctors are left to handle unruly patients. Only one common toilet is there for medical professionals in the hospitals. Professionals have to travel distances for washrooms accessibility in dark corners, dark alleys. As more and more women join the workforce, the nation cannot wait another rape for things to change on the ground. This is what the CJ has said at that time of the rape and murder of the doctor in Ajikar Hospital in Kolkata. These were the comments made. But has really the situation improved in hospitals across the country? And this was the committee they had formed. When we saw the members of the committee, they were who's who of the entire society. Dr. Nagesh Reddy, Dr. M. Srinivas for names, so many people. And ultimately, what the committee has recommended also was not much potent and really did not help. That's not my personal feeling. So this is by one article by retired Chief Justice N.V. Ramana. Only laws won't protect dogs. So just making laws. And this article was very good on neglected healthcare, violence, and how it is a huge concern. This also came in the aftermath of the Abhaya incident in 24. And the incident happened, as you remember, on August 9th. This was on August 20th, 2020. This was reaction from the then President Dr. Jaideep Tang. The letter sad, numb, hurt. I think he has so beautifully put all the feelings. I think we had experienced for days together: disbelief, shock, aching, aggrieved, agony, battered, indignant, resentment, anger, denial, frustration. These are many adjectives for our emotions, and yet none truly describe what we doctors and members of FOGSI felt and continue to feel after the gruesome rape and murder of one of our fraternity. A young doctor, a modern and empowered woman, on the cusp of a promising life and career of service to humanity, assaulted, sexually battered, beaten to death. In a way, nightmares are made of. In her place of work, compounding for all those who work in healthcare facilities. A hideous crime with a sense of dread and feeling of unsafe in the place which should have been the safest place for her. So these are some of the sentences from the letter he has sent to, I think, everybody in the higher powers, including the court. And this was after 1 month, 30 days of waiting and counting. So we thought of, no more waiting, and we should demand where is justice for Abhaya. And this was the time when FOGSI again rose. More than nearly 100 societies had again done. Some of them were huge rallies, some of them were huge representations, street plays, taking to the roads, taking to the streets. And at a single day and time on September 9th, 3 p.m. to 4 p.m. was the time given. And everybody responded. Such was the hurt and grief, and such was the feeling we had all experienced. And this is the media coverage done by all our doctors. So much had come in print media. It is not that we are not engaging with media. It's not that we are not engaging with public. Saw what happened. There's huge media interaction also in print and visual and visual media. This is the NMC website, which says that it has, the website has so many things, but there are no norms for safety and security. If you see, there are standards for education, there are standards for qualification, and standards for teaching eligibility, so many things. It's so full of rules, regulations, but nowhere are the norms for the safety and security of health. Why does a National Medical Commission not have norms? Because we have seen the postgraduate doctor suffering. So doctor safety and security have to be mandatory criteria for medical college recognition. This is one of the articles. So if you are going to recognize a medical college, for example, Arjikar here was a very, very old college, and we are giving so permissions to a lot of new colleges every year. But are the doctor safety and security the mandatory criteria when you are giving recognition? This is a very, very important question, very, very important report. So even when we are sending our own children, our own, young doctors to join colleges, how sure are we that they are going to be safe in their night shifts? So this is again, I have taken the liberty of taking from our own hospital. See the people thronging everywhere. The security is there, but it's only for namesake. They walk through the corridors, the males are there. You know how the security, lone, weak security, one man is there who is inadequately, is not at all equipped to deal with any kind of violence. And see the people who are allowed inside. This is again, this fellow, this head is that of a security. This door, particular door, the glass is already broken and not repaired. He's standing there, a lone person. See the number of people. This is the corridor to the emergency labor room and OT. This is a picture you see in many, many government hospitals. See the OP area. There are so many other issues also when you think of security, right? Because they put the security only for namesake, but the security is not at all effective. And you all know the reasons why. There are 100 reasons why that security is an issue. So see in contrast, when a properly maintained security and attendance is there, how safe and how private and confidential or safe, clean working place looks like. This is again why I have put these pictures is this was before the Abhaya incident. And after the Abhaya incident, because we all have given representations, even governments have taken some temporary measures or quick measures because they didn't want anything untoward happen further. So this is in our hospital at Vanaparthi. You can see this police is an SI. So there was an outpost created. We had given so many representations before, nothing was heard because they are also short on staff. Same thing, like medical healthcare facilities. Even the police are short on staff. They have other duties, so they don't consider protecting doctors as one of the priorities. So after that incident, we had this police doing rounds at the night and an outpost being there. Even it is continuing even today, though it was discontinued for a short period in between. But again, at least we have an outpost, we have numbers of the police, they come for rounds, and it was a much better place. You can see the labor room, the same entry, grills were made. There were no grills then, so now grills are made. So some kind of improvements. Again, when we come to the another kind of violence by own colleagues. So immediately, I think this happened in 24. Also, same before Abhaya. This is maybe you all either know this incident or not, but this is a Warangal Kakatiya Medical College student who died by suicide due to harassment by senior. The senior, they were belonging to anesthesia department. The senior was supposed to, constantly harass her, make her put her on a lot of extended hours and kind of tease her. So she had taken this extreme measure, and this boy senior was arrested, and I think he has lost his license and he has lost his medical profession, and he's also lost his total medical degree and all. So when we come to the abuse, violence amongst our own fraternity, let us face the issue. We all know that within our fraternity, especially in OB-GYN, there are a lot of reports of seniors not treating the juniors just as kind of humane or anything. This is one of the Google forms which the students had widely circulated among themselves. This is noted in the post RGR. You can see the college, the department, and the remarks. For example, D.Y. Patil Pune, pediatrics case filed for harassment, surgery harassment, JMC Calicut, ortho sexism, then other institute, anesthesia suicide, GMC Goa, OBG sexism, history of alleged murder of PG, MAMC, ortho. They have listed the departments which are toxic. They have listed the types of abuse which has happened. And mostly it is gender based. Most of it is sexual harassment. And so we have to rectify this inside us, put a mirror to ourselves and see what we can do. Because simply we cannot ignore what is happening within our fraternity and talk about others. See, when you see so many colleges, there are hundreds of colleges where they have put up evidence and reports and which department, what is happening. GMC Anantapur, OBG, ortho and surgery, unpaid stipends. So this is what our junior colleagues are facing, and sometimes it's a silent kind of abuse because they are not able to voice it due to various reasons. So what needs to be done is not simple, but again it is simple, just simple. It has to be given priority, and it has to be given the importance that it deserves. So we need a uniform central law. We need a government which is committed to safeguard its own healthcare workers. It should value its healthcare workers, and it knows the value of healthcare workers because it has seen in COVID, and that is the reason why so many medical colleges are being given permissions and so many medical graduates are coming out. But without quality, without safeguarding their safety, it's not going to work. Society to value its healthcare workers, judiciary, laws implementation, again sensitization and awareness of public, HCWs and police about the existing laws, and display prominently the punishments which can be there for VA HCWs, and code violate SOPs like that for other codes. So code violate has to be, the drill has to be practiced, and it has to be put up in everywhere, and alarm systems, the budget, and the local administration, the collectors and the police everywhere have to be involved, and the audits and the national task force. And the task force which was established, it should not be just another report. So there should be a time limit, and it has to come out with real solutions. So no safety, no duty. This was the big banner which was put up in the article for many months. So I think with this, it's not that I can offer a lot of solutions or anything. I just thought I would share some of the issues, and that's all, because we know that the solutions are still not there. We're still seeing so many issues. We're still fighting. Even justice for Abhaya has not happened. So I was thinking seriously about Dr. Basav's suggestion. He was asking us from the committee to, really archive and bring out the day-wise incidents, what happened to Abhaya, and put up in any of our websites so that it is not forgotten till justice is done. Otherwise, in 5 years' time, we ourselves don't recollect what has happened. It becomes just another incident. What else do we need to, what else? Because that is the ultimate, the most brutal thing that could have happened to a healthcare worker and a girl. So we don't need any other incident. I think we should keep on working on this. Maybe Abhaya campaign we can dedicate to violence against healthcare workers and seriously do something. Thank you.
Thank you.
Yes, ma'am. Thank you, ma'am.
very much.
It shows how deeply you are attached to this cause and how she works for the cause. Thank you so much, ma'am, for this wonderful insights. What doctors also should do and what we have to do. Okay, now I think Dr. Shobha ma'am is there, Dr. Vidya ma'am is there. Ma'am,
Vidya
for
Topi
your
ma'am,
opinions.
our Vice President.
Dr. Vidya Topi
Namaste,
ma'am.
namaste, Kiranmai. Hearty
Namaste.
congratulations. I am traveling from now Bangalore. I just landed from Kottayam and now I'll be going to Bijapur. But I must congratulate our whole Karnataka team. Whole Karnataka, all societies have participated to this
Yes,
day.
Karnataka has very
Congratulate Kiran. Kiran, I must congratulate you also. You motivated each one of them. Each one of them. And there also I met you. Hardly you were on the stage, you were climbing and I was coming down. But the enthusiasm flows from your talks. And so much you are engrossed in protecting everyone and you know the laws. I've seen you working as a chairperson of this committee also, and really it was wonderful. And we also in Kerala Federation of Obstetrics and Gynecology also, all
you
societies
made
joined
sure
on the
that
stage as well as yeah. So
thank you,
there
Vidya
also
madam, Shobha
we
madam,
did
Sheila
that. We
madam.
observed that. So
Thank
everybody
you
has
so much.
joined, and I must everybody has joined here
Yes.
from all the societies. Yeah. They
Yes,
did the
ma'am.
press release, they did Nautanki Natak. I saw Veena Bhatt, I saw Raj Lakshmi putting in the papers. And our Bijapur Obituary Society, they
Yes,
uploaded
they had a
in
huge
YouTube.
rally.
And yeah, and
Yes,
in my
ma'am.
college, they did big procession.
Yes,
So it
ma'am.
Yes,
was,
yes, ma'am.
yeah,
Yes,
yeah.
ma'am.
From
So
everywhere.
our
Yes,
our
From
Public
Venkateshwara.
Awareness Committee of Karnataka shines.
Yes.
thank you, ma'am. Ma'am,
How
as
much work they
the
have done, I also know. I
Madam,
mean,
we are
they are like
having the
real soldiers.
candle right
night
procession now in Mandya is going on, madam.
Yes,
Monday it
yes,
is
yes.
going on. It's going on in Tumkur. As the webinar was going on, we
Yes,
were
Dr.
getting the report.
Durgadas has promised me, he told I'll go and do definitely.
Yeah, he
Yes,
is
yes,
doing
yes,
that.
yes, yes,
Finance,
Kiran.
so many, yes.
Candlelight march is going on there in
Yes,
Tumkur.
Tumkur and Mandya. So,
Wonderful,
Yes.
wonderful, wonderful, wonderful. You did.
uh,
And even I saw in Kerala also, no? Kerala societies were so enthusiastic. Very nice, very nice.
Yeah.
Thank you.
Thank you,
Thank you
ma'am.
very
Dr.
much.
Nagraj
Thank
sir
you.
was there. Dr.
Uh,
Nagraj, our senior veteran, Nagraj
uh,
sir was
uh,
there. I think now he has put the message.
Shobha, I saw Shobha, I saw
Shobha ma'am is
Rajeshri.
there.
Rajeshri is also traveling from Mysore, I
Yeah,
think.
we started the
She
Yes,
program.
ma'am.
spoke
We
in the
started the
beginning.
program today.
She
But
made a very,
And I
very
think
passionate.
Shobha is in
hello. Yeah,
Operation
yeah.
Theatre.
So Kiran,
No, no, no. Shobha ma'am.
I am in the operation theater of every home. I'm in the kitchen.
Yes, yes, yes.
But,
So directly
but
I'm
so
coming
nice
to
of
you only.
everyone to join on a Sunday, ma'am. Thank you so much.
Yeah. See, we are
Actually,
joining for a
I think,
cause. We are
yes.
joining for the cause. That's why.
Mm. Lakshmi, can you take one picture so that we can put it up in the report also today's
Yes, ma'am. I have
Yes,
webinar?
ma'am.
taken.
You are
Yeah,
taken.
Shobha ma'am, yeah, please.
Rajlakshmi.
I have
Yeah,
taken, ma'am.
Rajlakshmi. So can I?
Yes, ma'am.
Hello, not audible?
Yes,
I
ma'am.
Yes,
wanted
You are
to
ma'am,
audible.
you're audible.
Yes,
You're
ma'am.
audible.
Shobha ma'am.
because we we started the meeting well in time today, and I must say that when we started, I didn't know that Kiran Mai had this much to share. I'm really kind of, I have seen her perform. I'm very proud of Kiran because when she started out, it was a new committee, and she did not have any work profile defined for her. She had no predecessors to relate, no past chairpersons to guide her. And she has been, am I not right, Kiran?
Yes,
Isn't it?
ma'am.
Yes, ma'am. This is the first term that I did.
Kiran is
It
not there?
was,
Yes,
I'm
she's
here,
there,
ma'am.
ma'am.
Kiran has
Yes,
left,
yes.
is
What
it?
you're saying is
Yeah,
true.
yeah,
What
yeah.
you're saying is
So
true. Yes,
that
it
is
is like,
why,
right.
yeah, you had absolutely no guiding light because we all had very strong chairpersons earlier to us
Yes.
to whom we could draw virgin field and look what you have achieved, look what you have built. So a huge lot of credit to you, Kiran. That's the reason I made it a point to come to your completion workshop also, and I blessed you there
Yes.
because
Thank
I
you.
felt
Thank you.
very moved by what you have achieved. So now
Thank you.
I have been thinking about this and about what Basab also has been saying. See, Kiran, you posted a lot of material which has been published, but we do not have any publication from India, I think so. And you
Yes.
quoted a lot of data which are coming from print media. But then, it will be so great to have an article every 3 months or 4 months in every edition of Jogi. So both of us are now corresponding editors. We can make it a point to say this time that there has to be an article on violence against doctors or
Healthcare.
healthcare or even patients, whatever,
Yes.
everything,
Yes.
this for this cause. Huh? So let us make it a point this time in September when we meet, and
In the
before that
September,
we'll put a
yes.
mail. Yeah, we'll put a mail to Dr. Dalvi also, Sujata, and we will
Yes.
request that, see, this is something that we need a support in some way, because what Basab says is very right. Basab was my immediate predecessor. He has a very astute mind, very refined thinking, and because he's younger than me, but I learned so much from him. And he actually, what he said makes a lot of sense. Nobody should forget. So whenever,
Yes.
Kiran Mai, 10 years later, 20 years later, 30 years later, whenever somebody wants to find out about this incident, They are not going to have any WhatsApp or Instagram where we have posted pictures. I don't think these things have retention time, quality. But if you put it into the print media, not just newspapers, but into our archives, our annals, our journals, that is how the story will be remembered. So, as the untold story or something like that, you craft an article on this, and some solutions will start coming up, because I think this has the potential to stimulate the thought leaders in our country, and they will be able to give us some solutions, certainly going forward. And also, hopefully, it will catch the attention of the younger generation, because they seem to matter a lot in decision making today. Hmm? Okay, so that
Yes.
was my input, and I feel that you should record it somewhere, so that people talking later will be having something to relate to, and they will not have to struggle with newspapers and everything. Something which concisely tells the story. Okay, please do that. It
Yes.
will be a
Yes.
great service not
It's
only
a
to
very
doctors but to
valuable
humanity
suggestion.
and to women's safety. Yeah, please
Very
take it
valuable
forward in
suggestion.
some way. If not Jogi, somewhere else. Yeah, do that, Kiran. And I think you will immortalize the story of Abhaya, and it deserves to be so, because I think what happened was really very brutal and very life changing for doctors, actually. Okay, so please do that. Hmm. And I think only you and your team, with all these worthy people which I'm having here, you are capable of it. Okay, all the
Thank you,
very
madam.
best.
Thank you, madam. Um, Thank you, Shobha Gudi madam, and thank you, Kiran madam. Yeah, such a
Thank you.
deep thoughts you gave about the safety and the security norms of healthcare workers. And really, we should all be aware of all these facts. So many things, and that violet code color only. Really, I was only not knowing, madam, what is the code
Yeah,
for this
and
thing. So,
today I think we are also very fortunate that today the vice president of FOGSI has joined, actually. So Vidya doesn't
No,
get
no,
When
no.
kind
It
they,
was
answers.
when
incidental.
she
So
What
was there
happened?
at Hyderabad, then she took the message to Kerala. Always she was in touch
yeah,
daily. I mean,
No, no, no.
yes,
It was
yes.
very,
really.
very
So we are
No, no.
fortunate
I
that
was
she
really
also.
motivated by our Kasoga team, actually. Kiran Mai, I must say that every society
yes.
has participated in that. So then I
As I
reminded,
was specifically
yeah,
mentioning the number of
yes, yes,
societies.
but
yeah.
throughout the nation, Dr. Kiranmai, madam, it is because of you only.
It's all
Ah,
We
yes.
people
sensitized,
like
really,
you,
really.
Ina madam, people like you in every state, you take it forward and I think FOGSI
Thank
is
Yes,
you.
yes.
people who want to do.
Rajashri,
Thank you,
ma'am, I
Veena.
think.
Thank you, Vidya ma'am. Thank you. Thank you for joining Vidya Tubi ma'am and
Thank
giving
you.
your
Thank you.
input.
Thank you. Thank you. Thank you. Thank you. Thank you.
Uh, we will
Thank
close,
you.
Rajashri.
Yeah,
Rajalakshmi.
please
Actually,
close.
I chose.
Please close.
Yes, ma'am. Rajalakshmi?
Actually, I joined because of Rajeshri, I must say. Otherwise, I had forgotten this webinar. I just means I was traveling, no, so I was not having link. Thank you, Rajeshri, Dr. Shobha, Dr. Veena, Rajalakshmi, and all others. I must mention here Dr. Dhananjaya also. Shobha Dhananjaya.
Thank you,
Shobha
madam.
Dhananjay is there. Dr. Shobha
She
ma'am,
is
you're
there.
there?
Done.
Yeah,
She
she
has
was
done
there.
wonderful work. She
Yes,
was
yes.
there. She has done wonderful work about this
Yes,
violence. Yeah, she
Thank
does
you.
she
in
was there.
Davangere. She was there.
Yes, she was there. She just messaged just now. I think she logged out.
Yeah.
Thank
She is
you.
a
She was
Thank
wonderful
you.
there.
worker. She is another wonderful worker. Thank you
Yes.
very much.
Thank
Thank
you.
you. Thank you.
Thank you,
Thank
madam.
you
Thank
all.
you.
Thank you. Thank you.
Thank you. Thank you,
Thank you
everyone.
once again,
So,
Kiranmai, ma'am. So much.
Thank you,
yeah.
madam.
Thank you.
So we would like to, from Kasoga group, we would like to thank Kiranmai ma'am for this webinar. All those people who have logged in, Dr. Rajeshri ma'am and Dr. Shobhaguri ma'am for the opportunity, and Arun for the network. There had been some problem because it's raining everywhere. Anyway, thank you everyone. We'll
Thank
close
you,
the
everyone.
meeting.
Thank you.
Yeah,
Thank you so
thank
much.
you.
Thank you.
Thank you, ma'am.
Thank you, Arun.